and you're welcome back to ETV Ghana's African Women's Voices Show. I am very ready to ask our guests questions around cervical cancer. Believe you me, I've heard about it, I've talked about it, but every time there's something new to learn around cervical cancer. And our guest tonight is from M Pharma. She is the COO of M Pharma, and she's got a lot to share with us tonight concerning cervical cancer. Let us make welcome Sophia Baidu. You're welcome to African Women's Voices Show. Great.
Me on your show.
Oh, she's happy to be on our show, and we're happy to also receive her. I mentioned that you are from M Pharma.
Yes.
Can we tell our audience exactly who M Pharma is?
Okay, so M Pharma is a tech-driven healthcare company. We're really seeking to build an Africa in good health. We're currently in 9 countries, including Ghana and Nigeria. We employ over 650 people. And out of that, I'm happy to say 46% of them are women. I'm very happy about that. And then, so I'm very happy about that. And then I think within our portfolio, we have 3 different businesses that really seek to address the issue around healthcare provision. We have 515 retail pharmacies across our network, through which we're doing a lot of primary healthcare programs to really reach out to the communities. And then we have a wholesale business unit that actually, if you look at our platform, the 9 countries, we supply about 900 hospitals and retail pharmacies with drugs and consumables. And finally, we have our diagnostics business. So many may not be aware, but M Pharma was very instrumental in the fight against COVID when COVID first came out.
Okay.
And so we as a company were responsible for 1 million COVID tests being dispensed through Ghana, Nigeria, Zambia, Kenya. And also we were able to distribute 150 PCR equipment. Because when COVID first came, the challenge was around testing. Do we have the capacity, the capability to test? So we provided 150, and in Ghana we provided 20 private labs and hospitals with PCR equipment. So the question then was, what happens to this equipment after COVID? And so then we said, okay, what is it that what else can we do? So one of the areas we looked at is molecular testing. Where are the areas where we still need to do better at? And so we came up with HPV, the cervical cancer, hepatitis B. So what we're really trying to do is to make sure that you don't have these white elephants sitting in the labs that after COVID they've made all this investment that they can't do anything with. And so we've created a diagnostic business to really support these labs, creating awareness and generating demand for other molecular testers.
That's awesome. Awesome. Phenomenal. Okay, so let's get to the business of the day.
Yeah.
When we say cervical cancer, what exactly do we mean?
Okay, so cervical cancer is most of the time caused by HPV, which is the human papilloma virus. And so when, and this is, it occurs when people are very sexually active, right, that you get cervical cancer. But when everybody gets HPV, as long as you are, sexually active, you get it. The issue is there are certain types that cause cancer. So for example, the types 16 and 18 cause 70% of the cervical cancer. So the question is, how can we make sure that we're testing to see this and preventing it from becoming full-blown cancers? So you really need to, abstinence is the best, but if you can't, then you need to make sure you're protecting yourself using condoms and also testing on a regular basis.
Okay, I just have this one question. Since being sexually active exposes you, it means that the men somehow give it to us?
Yes, men also get it.
They pass it on.
Exactly. And so actually there's a vaccine, right, for HPV, and the vaccine is actually for both young boys and young girls. So young boys or men can also get cancer.
Wow.
Yeah.
All right. So would you say that before you meet someone, you ask the person to
your status? Well, I would love to say that, what I would say to every woman is know your status, because when you know your status, you can do something about it. So what we want to do is to really encourage people to get tested. So
Okay.
for example, there was a study done last year in Ghana, and you want to test women between the ages of 25 to 64. And in Ghana, that's about 9.4 million women. And what the studies show that out of those 9.4 million, only 3% get screened. And last year, when they did get screened, about 2,800 tested positive for cervical cancer. And the sad part is last year alone, 1,800 women died
Whoa.
from cervical cancer. So it's a silent killer, and it's the second biggest killer after breast
The
cancer.
breast cancer.
So we really need to create awareness around it. And the thing is, when it's caught early, and this is very passionate for me because my mother had it, and it was caught early. And so we were able to address it. I just recently tested, and I tested positive, and I'm taking the next steps. So it's not a death sentence when caught early. So it's really about early detection. And it's a simple process. It's a simple process to do. You can do self-sampling at home and then take it to a lab. So it's not that difficult to do. And, it's an investment, but if you're not HIV positive, you only have to test every 4 to 5 years. So let's say a screening costs 400 Ghana cedis. You only have to do that 4 to 5 years, right? So why not make that investment?
Sure helps. We'll go for a quick commercial break. When we return, we talk about the risk factors. Do not go away. And you are welcome back to ETV Ghana's African Women's Voices show. Before we went on the break, she mentioned something that cervical cancer is a sexually transmitted disease. And when you get to meet with your male partner, he's likely to pass it on. But one thing is sure, you need to know your status as a woman and be sure to protect yourself once you know your status. And always make sure that you check yourself within 4 to 5 years. And it doesn't cost that much. If you have to spend only 400 Ghana cedis to know what your status is, it's really worth it, okay? So we said we're going to get to know what the risk factors are for this. So over to you. What are the risk factors?
Well, we talked about the fact that it's about protecting yourself,
Self.
right? And really, safe sex abstinence, reduce the amount of partners that, you're interacting with. I think that's the main thing, right? Anything just like HIV, limit it, protect yourself. So it's important that you own it and really make sure that you're protecting yourself.
All right. So now, let's talk about how we can prevent cervical cancer. What should we do? Because I know someone watching me right now could say, eesh, I don't know if I've got it or not.
Yeah.
What do I do?
So I think that there's the primary part where it's really about catching it when you're young, catching it when they're young. So in the UK, the National Health Service actually did a study where they vaccinated young girls between the ages of 9 to 12 and then watched them grow. And they realized that, the positivity rate was less amongst that cohort. And so what we really want to encourage going forward is vaccinations.
Great.
And starting early, 9 to 12 years, both boys and girls. Now, M-Pharma is now working on a partnership with Merck that produces the Gardasil vaccine. And so, what we're trying to do is to really come up with programs that will improve accessibility to this vaccine. So for children, you require 2 shots, the first one and then 6 months after that. For older women, it's the first one and then 3 months and then 6 months. So it's 3 shots that you need to take for adults and 2 shots for children.
Wow. So if I get you, it means this vaccine is going to prevent the HPV.
Yes. So, so for example, so I said that the HPV 16 and 18 cause 70% of the cervical cancer. So this Gardasil, for example, will protect you against 16 and 18, for example. So there's the vaccine. And then, as we talked about, it's about getting screened, getting tested. So for example, when you get screened and it's caught early, it's simple. If you're screened and it's caught early and it's You know, as I said, there's a 16 and 18, and then you have high risk, right? High risk, which is what I have. It wasn't 16 or 18 when I tested positive. It wasn't 16 or 18, but it's high risk HPV viruses.
Okay.
And so in that case, when you test positive for that, they have, the next step is for you to get a visual inspection with an acetic acid. So basically what they do is they go further and look into your cervix and put some acid. If it comes out white, and then all it is a thermal ablation, which is a small device that in 45 seconds for 50 Ghana cedis, it will burn the lesion.
Whoa.
That's how simple it is, right? And you can get that done. If you're 16 and 18, for example, and you go for colposcopy after you've tested, and they find that the lesion's there they do something that's called LEAP, which is basically what they do is they cut and remove the lesion from you, and you're fine. So there's simple things that you can do, and that, for example, is about 500 to 600 Ghana cedis for that, for the LEAP. And then, of course, if it goes into, if you don't detect it early and you leave it, then you have cancer. Then sometimes you may have to have a hysterectomy, which is when you have your womb removed and you can't have children anymore. So, you know, there was cases where women even actually die. So we don't need to get to that point. So it's really about early detection, getting tested, getting screened, and then, you know, solving the problem in its earlier stages before it becomes a bigger issue for you.
Wow. Thank you so much, M. Farmer, for trying to get the word out. We all need to have this early testing and consistent as well.
Yeah.
We don't want to get there, she said. We don't want to get there at all. So if you do it right now, it will really be worth it. So sometimes you hear pap smear, and then you hear HPV DNA testing.
Yes.
So many words. Are they the same?
They're not. And so, for example, this was the first time I actually got the HPV DNA test. For years, I've been doing the pap smear. So in terms of sensitivity, the pap smear is 49%, whereas the HPV DNA test is, in terms of sensitivity, is about 89%. So it's the HPV DNA, and that's what WHO and, you know, is recommending, is more accurate in detecting, it's more sensitive, so it can detect more of the cervical cancer, or sorry, of the HPV in you. So for example, the pap smear, basically they take a sample and put it under a microscope to see if they can see the virus or the cancer. Whereas the HPV actually tests for the DNA, the presence of that in your cervix.
Okay.
So it's more accurate, and that's where the sensitivity comes in.
Well, so that means when we go to the hospital to get checked,
Yeah.
we need to request for the DNA testing rather.
HPV, exactly,
The
as a
HPV
first
DNA
step.
testing.
Exactly, exactly.
Did you know about that? Well, M Pharma is really educating us, or would I say additional education, because I know I've had to treat this topic every year in January.
Yeah.
Every January, that's the awareness
Yes,
month,
yes.
and we talk about it, but this is new insight, and I'm really appreciating it. I hope you have your pens around you, writing down all you need to know about how to keep yourself safe and how to prevent it. And even when you go for the test and it's positive, what you need to do
Exactly.
is not a death sentence.
Yeah.
She mentioned that she also got tested and she's fine
I'm
because
very
she's taking
fine.
precaution.
Exactly. And I'm taking the right
Great.
measures, yeah.
So how do we incorporate HPV testing in cervical cancer screening? How do we do that?
Well, I think for us, what we're trying to do is to really create awareness and drive to these. So, for example, we have about 20 partner labs, and we started the latter part of last year, and we launched the 10,000 Women campaign, which is we wanted to screen 6,000 women in Ghana and 4,000 women in Nigeria for free. And so in Ghana, so far, we've tested, I think, 4,163 women. Out of that, 28% were positive. And so what we want to do is and we used 8 of our partner labs to do the testing. So what we want to do is to really create an awareness and make sure that people are going. So we have labs like Yamachi, Nyaho Hospital, Trust Hospital, Dangpong Hospital. All these hospitals offer the service. What we're also trying to do is it's a very private area, right, in
Okay.
terms of cervical getting tested. And some women may have some apprehension about, going and
How
putting.
far you could
Yeah,
go, you know?
exactly, exactly. That's a very, very private area. So there are other options. So one of the things we've done also is there's something called Evelyn brushes. So you actually can, in the privacy of your own home, take the sample yourself, right? And we've done that, we've done that with many women, over 200 women we've done that with in terms, I did the self-sampling. So you take the brush into the privacy of your own home, take the sample and send it to the lab and they can do the test for you. So we're making it easier to break some of the barriers that may prevent people from getting tested.
This is a very huge barrier.
Yeah,
A lot of times, when you think about the fact that you have to go somewhere,
exactly.
open up for them to just, like, nah,
Exactly.
I'm not doing this.
Exactly. So we want to make it more accessible and easier for people to do. And so that's one of the things we're trying to do, is to really get people to understand that you don't have to go to the hospital and, to the clinic. You can actually do it yourself. Now, if you do test positive, then of course you need to go and then, open your legs, et cetera, et cetera. But the initial stages can be prevented by just using the Evelyn brush, for example.
We have to go for another commercial break. When we come back, we'll talk more about the barriers. Do not go away. And you are welcome back to ETV Ghana's African Women's Voices show. It is getting really interesting because we're getting to find out new things about cervical cancer. Before we went on the break, we were talking about the barriers, that are actually preventing a lot of women from getting tested or even thinking about cervical cancer and its existence. No matter how we try to wish it away, cervical cancer is real and it's happening to a lot of people. And one of the barriers mentioned right now has to do with the fact that people are not comfortable to open up to other people to get tested. And for that reason, we have the self-test, which M Pharma actually, the self-sampling Evelyn brush.
Brushes, exactly.
Aha. So it's available at the M
Yeah.
Pharmacy
Yeah.
outlets. So it's something you need to get for yourself. Let's talk about a lot more barriers. And if there's any other barrier you think you want to mention, please send it to me on our Facebook page and I'll take a look at it. I was telling her that for me, one of the barriers is the injection. I just don't like injections.
It's a necessary evil.
Yeah, I can't help it. I just need to get that, that piercing to be able to protect myself. I look forward to having another test. I have actually tested as I speak, so I'm not just interviewing her for people watching. I am living the talk. I test, test, test. I do that. So let's go on with the barriers.
I think one of the other barriers also is around knowledge. Now, one of the things, M Pharma, we pride ourselves on is to making sure that we serve everybody along the economic line, from the lowest to the highest. And when we launched the 10,000 Women campaign, we went to Nzulezu,
in the Western region?
In the Western region, the village on the stilts. And we tested 100 women there. And there, actually, we gave them the self-sampling brushes, and they went into their rooms and quickly, took.
And were they able to do it?
Yes, and they were able to do it. And then we took the samples, we tested, and then we partnered with CCPTC, which is the Cervical Cancer Prevention and Treatment Center in Bato, with Dr. Ifa. Now, what Dr. Ifa is doing is amazing. So he's training nurses, right? And the reason why we're able to do this is because he's training nurses to take samples and to able to do the thermal ablation that I talked about. And so he's trained nurses over the 16 regions. And with his help, we're able to reach the women that we were able to reach. And so we went to Nzulezu, and the women actually went to see the king to get permission to go. And when we got there, they were so excited because nobody's ever come to them. Nobody's ever reached out to them, and most of them weren't even aware of what cervical cancer was. And so we took their samples, they got tested, and the ones who were positive, they actually CCPTC went back and did the treatments that I talked about where it was necessary for the women in their village. So there's modern technologies that are making it easy and accessible. Now previously this 50-second or 45-second procedure would have to be done in a hospital. But now there's all these technologies making it more mobile for you to, reach the remote places. So the first thing is access and knowledge. And so what we're really trying to do is to create awareness. And that's what the 10,000 Women campaign is really hinged on. Let's create awareness and keep it going to really let people know what this is, because many do not know about cervical cancer. So that's one of the barriers. And then cost. Now I mentioned it's 400 Ghana cedis. For some, it's still expensive. But for some of us, you spend that much on a month on our hair and our nails, for example.
Oh yeah.
And you only have to test.
Sure
you only have to test every 4 years. So when you make that investment, it's like 100 cedis a month, or less, 100 cedis a year that you're having to save. So in that sense, it's about affordability. And even though we're offering this service for free, the testing for free, I think that one of the things we want to look at and possibly look forward is how we can do subsidizing programs with maybe the governments or whatever to really make sure that we can make it more affordable for those who truly cannot afford it. So when we actually launched this campaign, one of the criteria was reaching women who've never tested before or could never afford to have this test. And so I think for us, it's really also looking at how we can partner with, governments or whomever to really subsidize those who are, more impoverished that want to, but can't do this.
Wow. I am so moved by the thought around what you're doing. You want to be able to reach women that haven't been tested ever before, and women who probably cannot afford it.
Exactly.
And you're seeking partners to be able to champion this and ensure that just because you don't have the money doesn't mean you should fall sick, with cervical cancer. It doesn't mean that we'll leave you to die.
We don't want to. We don't want to.
Thank you. Thank you so, so much. Thank you to M Pharma, and thank you to the doctor who has been able to train nurses
Dr. Efa.
across, Dr. Efa. We are very thankful. African Women's Voices Show is thankful to you for what you're doing, because it takes someone who has the heart of care to really think about ways to ensure that things are done better. And when it comes to how we are living our lives, we live a better life. And we are praying for you, and we're supporting you and cheering you on that you do much more for us, even as we thank you for what you've done. Thank you so much. So what about cultural barriers? What do we have to say about that? Because here in Africa, we're so patriarchal.
Yeah.
And we are not allowed to expose ourselves to other men and all of that.
Yeah.
That's supposed to be a barrier, isn't it?
Yes, and I think that's very important. And one of the things we want to talk about, it's not to just say it's a women's disease, right? Because it affects the entire family. So we need to get the men involved as well. And when we were starting this project, one of our colleagues talked about the fact that in Nigeria, in the northern part, for example, it's the man who makes the decisions. So if you want the women to be activated to do these things, then you need to go through the men. So it's important that it's not just carved out as a women's disease, but it's actually a family. And therefore we need to get the men involved to encourage their wives, for lack of a better way of putting it, to give them the permission to be able to get these tests. And then also to encourage our sisters, our mothers, our girlfriends, our wives, to make sure that they're aware and they're getting the test.
And one thing with us is, because of the society we find ourselves in, once we have the permission or we have the approval of our male partners, of our brothers, we are much more comfortable to go get the test. Because it's like, okay, there's no barrier anymore. He's not going to judge me for exposing myself to get tested and all of that.
It's important.
That's a good one.
Yeah.
So men, a lot of you watch this show. You watch with your wives, you watch with your girlfriends. We are pleading with you to understand us that we don't want this to just remain a woman's disease. That's how the perception has been over time. It's been like, well, it's a woman's thing. I can't help it. You take care of yourself and all of that. But this time around, we need to work with you to ensure that things get better in the conversations around cervical cancer. I'm going for my last commercial break. When we return, we'll open the phone lines. You could call in if you're a man to air your view. If you're a woman who just got tested and you want to share your story, please go ahead. Whatever it is you want to say, once it's about cervical cancer, we'll like to hear it. So do stay tuned. We'll be right back. And you're welcome back to ETV Ghana's African Women's Voices Show. I am going to our Facebook page to see what you're saying. And I see Bless Dine. He says, I'm watching. And he says, great show. I see likewise Asari. He's sending us the fire emoji, meaning he's enjoying it. And then Paul Eniyi has sent us the hearts. He's very happy. And then we have Benedicta. Benedicta, I think she sent in a comment when we were talking about the barriers. And she mentioned two key items that she feels shy and also the costs. So you see, if M Pharma gets the partners they're looking for, who knows? You could be part of the beneficiaries who are going to enjoy what service they're going to be providing. So let's all make the noise and reach out to possible partners and even the government and ask them to reach out to M Pharma and partner with them and get this service out there for people who can't afford it. Now I'm seeing quite a number of you sending in your waves and your highs from wherever you're watching. And I see you're watching from Casablanca, from Ouagadougou, from Sri Lanka, from Abuja, Enugu, Port Harcourt. I see from Zamfara State, quite a number of you are watching from Nigeria. And she mentioned that the tests are also ongoing there. So it's good you're getting the information from us as well. Thank you so much. From Cairo, I see you sending in your wave. I see also from the US, you're watching us from New York. Informa, thank you so much for joining the show. I see from, I'm scrolling, okay, you're watching from Russia. Whoa, from Russia, thank you so much that you're watching. And I'm coming down to Ghana. Who is watching us from Ghana? Okay, I see Accra. You're watching from Accra, from Zabzugu, from the Volta region, from Salt Pond, from Axine, Halfasini. You're all watching. Thank you so much. We are happy you've joined. And if you're a man, remember we said we need you to be part of this advocacy. We need you to encourage your sisters, your wives, your girlfriends, grandmothers, mothers, every female in the family. Encourage them all to get tested and also to protect themselves. Very, very important. We need to do all that. Well, let's get back to the conversation. Before we do that, can we open the phone lines, Director? We can open the phone lines. Okay, so please, the number is going to be on your screen right now. If you want to call in, please go ahead and call, okay? Or you can send your message to our Facebook page. Whichever way, we are very okay with that, right? Okay. So we just have about some 10 minutes to wrap up the conversation. And it's been quite insightful, and I am very happy that we've had this conversation. Sometimes people feel that we need to have this conversation only in January because that's the awareness month. M Pharma says no. You've heard about it in January. You need to hear about it all the time. Because when we consistently remind you that you need to get tested, it's a lot better for us to. Do we have a caller? Hello. Good evening. What's your name?
Please, I'm Manetia.
Okay, and where are you calling from?
Please, I'm calling from Ablekuma.
All right, please go ahead and talk to us.
Please, I'm Manetia.
Yeah, Nanekia, go ahead.
I'm calling from Okay. Please, it's the first time watching your show.
This is your first time. Okay. Thank you. Thank you for watching.
Okay. Please, for the topic you're talking about, I don't actually know much about it. I'll be glad if I'll be glad if you could tell me about it, like how the cervical cancer is. Because there is a friend who is of late she has been experiencing some kind of um, balls and other things around her reproductive part that place. So I really want to know much about how the cervical cancer is all about, and
Okay.
if there's the need for her to go and do a test and then to know
Okay.
the actual thing, as if she's having or not, and then the medication she's supposed to take. It
All
was
right.
that serious. It was that serious, but then it has come down small. But there's still traces of some balls that you can see that it's within the body. It's within the body, but you see traces of it.
Okay. All right. So you can go off the line and keep watching. She will respond to your question, okay? Thank you. Thank you. All right.
Okay, Nanekia,
Yes.
thank you for your question. I'm not a doctor or a gynecologist, but I think that maybe you should go to a gynecologist and get tested. It may not be cervical cancer or HPV, but I think it's good that you go and get tested. But I think, you know, when cervical cancer is in advanced stages, there's discharge, unpleasant smell. So I think that, you know, go and get tested. Go to your gynecologist, let them assess you and decide what is going on and then take it from there. I can't say from what you're telling me that is cervical cancer, but I think it's good for you to go and or have your friend see a gynecologist to really determine what's going on.
Okay. I think if I understand her well, she wants to know if maybe for some women, if they have the cervical cancer, do they experience boils?
I don't think so.
Okay.
I don't think
All
so.
right.
But
So
I
let's
think,
have her
yeah,
get tested, okay?
yeah.
All right. We have another caller. What's your name?
Yes, my name is Ahoa Amdo, calling from Tamale.
Calling from Tamale.
Yes, please.
Okay, please go ahead.
The barren, even some of we the men. Hello?
Yes.
Yes.
We can hear you.
Yes, even some of the men will give our wives the chance, but it seems they are using it to do like something they want to. It's like a collateral to us. If you don't do this, we won't go and test.
Okay.
We'll be to bully us, something like that.
Okay.
I can remember sometime they were doing it free at the Thermal Teaching Hospital. I asked I took my wife there. She did the test. And they told her to come back. They told her to come back. She and other ladies, but not everybody. And she didn't go back because when she was going, I didn't have money to go in. But I said she should go and find out what it is because I was busy that day. And because I wasn't having money for her to go with, but I gave her a lot of fare and all that. She refused to go. So I want to know, when they said she should come back, was it something we should be scared or take a serious?
Okay.
Or we've not been able to go back and we've not done another test to see.
Okay. So you can
Yes.
go off the line. She's going to respond, okay?
Thank you.
Thank you.
Okay, I'm not sure why they said, I mean, they take the sample and then they have to test it. Maybe, I'm not sure if they asked for him to come back for the results and they never went back for the results. So I can't determine from that whether or not it was something serious. But if they do take a sample, then you should go back and get the results. And then once you have the results, you determine what, you know, if it's, like I said, if it's positive, then, you know, get out of jail card for free for the next 4 to 5 years. If it's positive, what is it? Is it 16, 18, or high risk? and then, that will determine what kind of treatment. But from what he's saying, I can't really deduce that it was cancer or it's HPV or not, because I think it's not clear if they never went for the results.
Yeah, they
of the
never went for
test.
they didn't go back, but
Yeah.
his concern now is usually other people go for the test and they're not asked to like come back. So in his wife's case, they asked her to come back. So he's just wondering, when they say people should come back, does it mean it's because they've seen something they should be afraid of? Or maybe it's just a procedure? That's what he's concerned about.
Okay. In my experience, even with a pap smear, you take it and you go and come back for the results. The results are never given to you on the same day. You have to come back for the results. With the HPV DNA, you have to come back for the results. So if it's the test that they went for, whether the pap smear or HPV, they would ask you to come back to get the results, because I don't think it's instant that you get the results.
Yeah, so sir, no cause for alarm, okay? You just need to get her tested. In my own experience, when I was asked to come back, I came back and they were just counseling me. They told me everything was okay, but I still need to ensure that I check every 4 to 5 years. So it was more about getting counsel. So it could be that's also what they wanted to do for your wife. However, you just need to know what the result is. So don't panic yet. There's no need to panic. It could just be for them to cancel her.
Yeah.
So try and get the funds together. Let her go.
Yeah.
And then, wifey, if you're watching, please do not use it as a collateral and say, if you don't do A, then I'm not going to get tested. We are trying to get the men involved here. And if they begin to talk to themselves and they see that we are using it as a collateral, they won't support us anymore. And we need their support. So from a woman to a woman, please get tested. He really wants to be sure that you're okay. He wants you to be healthy, for him to enjoy you the more and for you to enjoy each other. Okay? All right. I think we're going to be drawing the curtains here. We can't take any more calls. So what would your final words be to whoever is watching us right now?
I think you summed it up. You summed it up by what you just said. Please, 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 please know your status. And when you know your status, you can do something about court early. A simple procedure, 45 seconds, can relieve you of any future pain or anguish. So please, please, please get tested, get tested, get tested. 400 Ghana cedis. Some of us save for a month, save for 2 months, get tested, because the health is important, long term versus short term. So please, I encourage everyone to please, please go out there and get tested and know your status.
Thank you so much, Sophia. You see, it was worth it. My voice is not sounding good, but I really needed us to have this conversation. I didn't want to postpone it. I'm sure we've been able to reach somebody tonight around cervical cancer. Something you've not known in the past, you've gotten to know tonight. I am so happy that I did not say, oh, I'm not sounding good, so I'm not coming on air. I really am happy to also see new people watching the show. Nanekia, I'm happy you watched it. So look out for us next week, Wednesday. We'll be here with another interesting edition. All right? So until we meet next week, do enjoy the rest of our interesting lineup for you. Bye-bye.
Thank you.